good to have you with us in this edition of the Urban Debate. Viewers, tonight we begin with the focus on the national capital. In the last several days, there's been a huge amount of conversation regarding the surge in cases in the national capital. Of course, there's politics that's played out, there's exchange of words that's happened between the Aam Aadmi Party, BJP and even Congress trying to question the Aam Aadmi Party there. There's also a bit of a face-off that's taken place between the Delhi government and the Lieutenant Governor. Now, let me just take you through that detailed timeline because this is very important to the conversation we'll have tonight and to the questions that I'm going to raise for our panelists tonight. On June 6th, the Delhi government revised its testing strategy and said that the asymptomatic people who are not showing any symptoms of coronavirus will not be tested. And the government said this is being done because everybody cannot be tested at this point of time. They need to have a more prudent policy. On June 7, Delhi government said that they're going to reserve the Delhi government-run hospitals and the private hospitals only for the residents of Delhi. No outsiders will be allowed. There are too many cases coming in. They're prepared to handle Delhi, but if outsiders start coming in, it will become a challenge. But a day later, on June 8, Delhi Lieutenant Governor overruled this order. He said this is not right and it cannot be accepted that the hospitals in the national capital will treat everybody and cannot deny treatment to anybody. He also said that the Delhi government must follow the guidelines of ICMR and ensure that even asymptomatics are tested if they are high risk and direct contacts of a COVID patient. Then today we saw the Delhi government hold a meeting with a bunch of officials from state, disaster management authority and the center. The point of conversation was also to see if there is community spread within the national capital. The Delhi government indicated in many ways that there may be a community spread, that over 50% of the cases in Delhi, for them the origin is unknown, which means how do these people get the infection? Perhaps there is community transmission in parts now. But they also went on to say, but the center is disagreeing. They have to decide whether to call this community transmission or not, and so that's where those things stand. The Deputy Chief Minister of Delhi then made a very big comment, and he said that cases are rising and so is the need of the beds. That it is projected, estimated as per their own internal calculation, that perhaps Delhi will have 5.5 lakh cases by the end of July, by 31st of July. And then Delhi will need 80,000 beds. Now, of course, all of this is being said to build the case that we need to give priority to the people of Delhi. We need to have hospitals first for them. If we also start catering to the outsiders, then we won't have enough infrastructure, we won't have enough beds. But let me give you this breakup because, like I said, this is a big number. For the Delhi government to say it is projected that Delhi may have 5.5 lakh cases by end of July. Now, this is the estimate they are presenting. According to the Delhi government, by June 15, it is projected to have 44,000 cases and 6,600 beds will be needed. By end of this month, there would be 1 lakh cases. There could be 1 lakh cases in the national capital, and then the bed requirement would go up to 15,000. Add another 15 days to that. By mid-July, the Delhi government says it is expected and projected that the COVID cases go to 2.25 lakh, and by end of July to 5.5 lakh. Now, if this indeed is a case, viewers, this is a massive crisis. This is a huge number. Let's try and understand the basis for this number. Is it really possible? Yes, there has been a surge in the last 10 days. Almost on a daily basis, we are seeing a high number of cases being registered and tested positive. But 5.5 lakh, is this a massive crisis? Or is there some amount of fear-mongering that is being done to build a case for keeping hospitals only for the people of Delhi? Is this a route being taken by the Delhi government so that they don't have to answer questions about how come they are not prepared so far, how come they are still adding beds and are running short on beds? So let's say good evening. These are the questions that I have. We've got experts and we've got political representatives to have a constructive, rational conversation of just what is it that India's national capital is looking at. So let's say good evening to RP Singh, National Secretary of the BJP, Dr. Devinder Singh Rana, Chairman of the Board of Management at this Ganga Ram Hospital, one of the biggest in the national capital. Dr. K Monga, he is the Chairman for the IMA Hospital Board of India. But first up, I actually want to go across to Akshay Marathe of the Aam Aadmi Party to understand this math. Akshay, basis what, can you give more insights on these numbers that were given by the government today?
Thanks, Tanvi, for having me on the show. Let me first start off by telling you that these are not Delhi government's numbers. We had appointed a panel of expert doctors and data scientists to actually look at the trend of rising coronavirus cases and use the transmission rate, that is the R0 rate as it is called around the world, to calculate how many patients are likely to come up to our hospitals in the next 2 months. And this modeling has happened across the world. Delhi is not the first government to actually do this modeling. New York did it, Italy did it, France did it. I think all governments must do this modeling to be able to be prepared to handle the number of the spikes in cases that we are going to see, not just in Delhi. This is not a problem that is going to happen in Delhi alone. We are going to see similar numbers across the country. The reason that we put these numbers in the public domain today is so that there is some consensus on the matter of whether we have entered community transmission or not. And the problem in India right now is that the central government is being adamant about not calling it community transmission. And the reason that we want the central government to start recognizing the scale of the problem is because as soon as we say that we have entered community transmission, the strategy for every state to deal with the problem is going to change. Now, what do I mean by that? What I mean by that is that right now, because we are supposedly still not in community transmission, a lot of our resources on the district level, whether it's Anganwadi workers, Asha workers, it's district dispensaries, their doctors, their paramedic staff, all of these government officials are currently investing their resources into contact tracing and figuring out the source of all cases. But like Satyendra Jain, our health minister, said, we do not know where 50% of our cases have come from. And let me again clarify, this is not something that is the reality in Delhi alone. The same situation exists in Mumbai, in Gujarat, in Tamil Nadu, and several other states where coronavirus has taken this state that we are in now. So when we say that we need 5 lakh, we are going to touch 5 lakh cases by the end of July.
So let me ask you this question, Akshay. Let me ask you this question. You're right. Everybody is doing this math. There are many models out there. We here at the Times Network have also, with an external agency, constantly mapped it out. We've largely been on the dot, on the ball with those projections as well. I understand. But I just want to know this. This 5.5 lakh estimate is basis what data, how long ago? Data collected till when? Because honestly speaking, Akshay, there has been a turnaround and a spike that we are suddenly seeing perhaps in the last 8-10 days. So what are you factoring in when you tell us 5.5 lakh cases by end of July?
Tanvi, coronavirus is known around the world to take an exponential rate of growth. So when this committee was set up, it was set up about 1 week ago, and they were tracking the doubling rate of the virus in the last 2 months. And in fact, of course, like we all knew, it was post the lockdown that the real spike towards exponential growth started. And that is the reason that we had to do this modeling now. Pre-lockdown models were not sufficiently able to capture the rate of growth of coronavirus post-lockdown. This is why we had set up the committee to figure out how many beds would Delhi need, given that Delhi's population remains the same, nobody comes in from outside. The number of beds required per case or the ratio of beds to cases remains the same. So this is the basis of our calculation. You are free to go into similar data sets and modeling. I'm sure you will find very similar numbers because this is the standard rate of growth of coronavirus across the world. So Delhi and India cannot be an exception to it. The reason that we actually put this number out in the public domain, like I said earlier, it's not just about community transmission. We are not even saying that we are not prepared to handle it. But people have the right to know that when Delhi's borders are going to open up, So many people are likely to have an influx into the city. We have to be prepared for more cases than we have even projected. So this is a hard fact that Delhi has to account for when it starts preparing for the next 2 months. As of today, we have more than sufficient beds. We have 9,000 beds right now, of which 4,000 beds happen to be vacant. You can take your reporter to LNJP, GTB Hospital, Rajiv Gandhi Hospital, which are all Delhi government hospitals, and they have spare capacity as of today.
Okay, all right. No, I agree with you. I'm just saying this, and I am a little surprised by the numbers you're putting out, which is why I want to have this conversation, is to say, where is it turning? Where is it changing suddenly for Delhi? The projections, even our own internal calculations, which are still largely in line with the number of cases Delhi is reporting, a couple of thousand behind that, would show that the peak would happen in a few weeks, and then the cases would actually begin to reduce, at least the active cases. So I'm wondering where it's going wrong. Let's ask our experts. Dr. Monga, what is your own sense? Is there a possibility that keeping in mind the current scenario, we hit 5.5 lakh cases by end of July, and we will then need 80,000 beds in Delhi?
Rightly said, Tanvi. Basically, the projections are pretty correct. I believe that. I mean, I'm depending upon so many factors, like the numbers are increasing. In fact, they are multiplying. And the government has not been able to control the spread over the last 2 months. And, there is no direction. I mean, the Delhi government, I'm talking non-political, Delhi government, whosoever it is, I mean, they have always been changing their strategies and then trying to hide figures. Why scared of numbers? There should be more and more. There should be more testing. And in fact, the number of containment zones which were there 90 or 100 to start with, they have gone to 200 now. So I think the government at some time, even the chief minister, should admit that there is a failure on the part of the government. And it is a panic situation, not only a panic situation, it's a crisis situation. And unless government takes is as a failure on their part and evolves strategies to look into these issues in a better way, in a coordinated way, and take everybody into confidence, take the LG into confidence, take the private sector into confidence, all the laboratories into confidence. It's a matter of faith and trust with all their stakeholders, which I think they have been lacking. So as a public health, I'll expect that definitely it's a failure, number one. Okay.
When you say failure, Dr. Monga, in what ways do you mean failure?
I mean,
failure
we
to
have
build
not been
health
able
infrastructure, perhaps I will agree with you, but failure to implement the lockdown, failure to test enough, what are you talking about?
Yes, I'm talking about, it's not one factor which has contributed to all this. Number one, containment was tardy in Delhi. I mean, people were roaming about. They should have taken it much more serious, especially the first part of the lockdown. They could have done better, number one. Number two, the Markaz issue cropped in. And even in that Markaz issue, I think Delhi government did not play their part well. Then, I mean, they're not able to control the spread because of ever-changing guidelines also. And in the last few weeks, you have seen that, I mean, they have now started hiding figures. Once you start hiding figures, you are allowing community spread. Akshay was saying about community spread in the country. I am saying in Delhi it has happened just because Delhi government has tried to hide the figures. Let more and more people do the test. And if he says that it is ICMR guidelines, no. At one time we faltered in the last few days. We did not allow the asymptomatic contacts of proven cases to be tested. That was a big blunder. Then taking action on all these laboratories. Laboratories was a big flaw. I mean, they shouldn't have done it. So all these things have been happening, and I think the government could have done better.
Let's take it point by point, Dr. Monga.
Yeah.
All right, Akshay, I know you want to respond, but let me just bring in Mr. R.P. Singh also. I'm sure you would want to respond to both of them and the points they're making. So just hang on for a couple of more minutes. Mr. R.P. Singh, 5.5 lakh cases, if it has to be taken, it has to be believed, if it has to be taken seriously, then that alarm bell should go off ringing even at the center.
Well, surely, and I'm saying on record that we are prepared to go to any extent to support the state government, but arrangement has to be made by them. The health is the state subject, not the center subject. And whatever help they need will go all out to support them. But as Dr. Monga was saying, they have to come right and then very straightforward on figures and data, because just all of the war against corona can't be fought only on just coming on the television every day and saying we are prepared 4 times better than we are better than corona. Corona se 4 guna aage hain. We are far ahead of than corona. It doesn't work that way. You have to work with data, figure, and preparedness for that. And I'm sorry, I mean, we data figures being fudged or being hidden intendingly, and also preparedness goes. Let me give you one example. 7th April, our Chief Minister said that we are ready with some 30,000 beds. Here's the press note. And then it said 8,000 hospital beds and some 20,000 beds otherwise. Even today they don't have. And let me just tell you another thing. 2017, they categorically said that we are gearing up for 10,000 to 25,000 beds. Never happened. 2018 is in their manifesto. It's part of their agenda only. 2018 they said we'll add 15,000 beds in 2019. That never happened. So issue is, are we prepared? And I'm saying again requesting, let's not get to slugfest. We are prepared to cooperate and go to any extent. Please prepare Delhi for that, and then don't open up. They take flimsy things saying that center has said so. Center gives you upper mark. You can always reduce it. If center says open up, yes, you can say no, we won't open up. We don't need to open up. You don't need to open up. So be very cautious on this. I was shocked. Sodia Sahab said open up schools in July. I mean, how can you even imagine in this condition when you're saying there will be 5 lakh cases in Delhi, you're trying to open up schools, and this pretext of saying that outsiders will come to Delhi. I'll appreciate Delhi government should release a data of all those patients who are coming from outside in Delhi hospital every day. Who will come to Delhi, man? 5 lakh patients. Everyone is scared. Shit. I'm sorry to use this word. Everyone is scared of coming to Delhi today. No one's going to come to Delhi for treatment in such conditions where there are 5 lakh people with corona. So let's admit it. Let's admit that we have not prepared well. Now there's a chance still. There's still a chance. Let's work together. And small request. They can always reach out to railway department. Ask them they are prepared with some bogies which can be used for hospital beds. So they can request for that. And one very small point. Kalkaji and Tilak Nagar has 100-bed hospitals which are already ready. The facility was ready but not switched on. So they can take over those hospitals from MCD and then start working.
I agree with you, Mr. R.P. Singh. Yes, take over the MCD hospitals, the private hospitals, the central government needs to step up on it, all of this, yes. And in fact, we will come to that part on what needs to be done now in just a bit. But Akshay Marathe, to you, respond to what 2 of our guests have said, because there is a question now being asked that was the Delhi government suppressing the numbers? How is it that suddenly we are looking at this now?
The question of suppression of data, I think the Delhi High Court has already looked into this matter. They have investigated and they have come out very strongly in our support, and they have said that Delhi government is above board in its reporting of data. So when it comes to the question of suppression of data, I think there are several other states in the country who have already set the standards so far below Delhi's that there is no question of debating whether Delhi is suppressing data or not. When it comes to testing, I want to tell all your viewers, do you know that Delhi is actually testing 3 times higher than the national average? Today, Delhi has tested 12,500 people per million. Do you know how many people Uttar Pradesh has tested per million? 3,000. Do you know how many Gujarat has tested? 4,000. Do you know how many Tamil Nadu, which is second after Delhi, has tested? 7,000. So when it comes to testing, Delhi is actually far ahead of the pack. I want to just compare Delhi and Gurgaon because they are so close to each other. Do you know how many people were tested in Gurgaon, which is under the Bharatiya Janata Party, just yesterday? Only 430 people were tested, out of which 240 were positive. Gurgaon has a positivity rate of 54%. You will be shocked to find out this. But only because it is not part of the national capital, do channels not take debates on that? And which is fine. Delhi is important. Delhi is the capital. We should talk about Delhi. But we cannot take Delhi consider Delhi to be an isolated case. Delhi actually started its fight with corona from 3,000 cases as a baseline. We had 2,000 cases from the Markaz incident. We had 1,500 cases that were coming in from people who flew into Delhi in the initial part of the corona pandemic. So Delhi has had to deal with a disproportionate number of cases right from the word go. Now, when I come to the Bharatiya Janata Party's central government and MCD hospital, let me just make a very small point. There are two kinds of government hospitals in Delhi. One is the central government hospitals, and then there are the Delhi government hospitals. Out of the 10,000 Delhi government hospital beds that Delhi has, 5,000, 50% of our capacity has already been dedicated to COVID. I want to ask today, why is it that out of the 10,000 hospital beds that central government has in Delhi, only 900 beds are available for COVID patients? Why is it that 3,500 beds that are run by the Bharatiya Janata Party's MCD, out of 3,500, 0 patients are currently in their facilities? So is it that Aam Aadmi Party is the only party that is running Delhi? Absolutely not. The BJP has an equal stake in running Delhi. They have to do their part. They cannot blame Aam Aadmi Party for everything that goes wrong. We are in the middle of a global pandemic. We have to work together. If you look at the last 3 months, how many times has Mr. Arvind Kejriwal, the Chief Minister, mentioned the Prime Minister or the BJP or the central government in a negative connotation? We have come forward. We are willing to work together with the BJP. The BJP has to show intent and honesty when it comes to dealing with us and not engage in mudslinging.
Okay. Now, before I get Mr. Singh to respond to that, can I please go across to Dr. Devinder Singh Rana? He's not spoken so far, and I actually had a couple of specific questions for him. Dr. Rana, thank you so much for joining us and for patiently waiting for your turn. Dr. Rana, do you believe that there is a possibility we would look at these in many cases by the end of July? It's a staggering number from where Delhi stands right now. On a daily basis, right now we are reporting about 900 to 1,000 cases.
Tanvi, thank you very much. But let me tell you that I am a physician and partly administrator, and I am not an epidemiologist. So, as Akshay told, that they have already taken an opinion of the epidemiologists and the team of epidemiologists. Maybe that they are right, and let me tell you here. Actually, it is anybody's guess. Probably regarding corona, nobody. It is just a guess. Nobody knows what is going to happen next month or after next month. But after all, people, those who are expert in this, they must have done it. But that is a very alarming number, and if that happens, then I don't know how will we get so many beds from there, And so that is the answer to your question. And what do you want to know more?
Okay,
but
so
however,
the point that is being raised is that we will need 80,000 beds by end of July, Dr. Rana. Where do we get 80,000 beds? Do you believe that it is time also for, the civic body hospitals, the central government hospitals, the hotels and school buildings to be roped in?
So, let me tell you that Akshay told that 50% of government hospital beds are reserved for COVID. And I think I like this statement that 50% they are probably treating non-COVID patients. And that is what should apply to even private hospitals when they are taking help. If the crisis rise like that, 80,000 or so, then probably 100% beds of private and government hospitals will be utilized. But if that is a fear, then I feel the government of Delhi and central government, since it is the capital of the country, then by this time or even from today, they should start constructing some hospital dedicated for COVID. And that is the only answer, because by no means, I don't know, but I don't think we have got 80,000 beds combined together in government hospitals and private and this state-run hospitals. So how do we get, like, if we are admitting only, say, serious patient, it is very difficult to manage serious patient in hotels and turn into, say, hospitals. Maybe that in convalescence phase, when they're recovering, we can put some patient there. So that will be there, but then that is all hotels can take care, not more than that,
Okay, Mr. R.P. Singh, you needed to come and respond to what, Akshay Marathe was saying. And to my question as well, why shouldn't we free up more beds and more resources of the central government and the MCD hospitals?
I said, you probably have started with that Delhi government can issue notice tomorrow itself and take over the MCD hospital, Dayanand Hospital, two hospitals which are ready in Tilanagar and Kalkaji and Hindurao. I mean, it's up to them to take a call and then let them do it. Who's stopping them from doing it? But they will say, oh, MCD should do it. I'm saying, let Delhi government take over them. Secondly, I'm saying, let them write a letter to Railway Minister, ask for additional bogies. If there's a condition, we need 80,000 beds. And then thirdly also, I mean, why are you delaying it? You pick up all dharamshalas, everything you have to pick up, block all hotels. But for God's sake, act now. Don't wait for it to happen, the bomb to blast. And don't blame it that since the LD has reversed the order on the saying of the Supreme Court which says that right to life and right to health are equal. So don't blame that, because I'm telling you, I'll appreciate, put a notice every day with how many patients from other part of the country are coming for COVID. For COVID. I mean, otherwise, leave otherwise. But how many patients are coming for, and as for your test thing, sir, you have blocked the test just a few days back, you blocked all testing. I knew a patient who wanted to get herself operated. She has to go all the way to Gurgaon to get a COVID test to get operated in Delhi. So, I mean, Dr. Rao will tell you this, that you did allow people to get a COVID test in Delhi. Even for a patient who has to get operated for cancer or heart, if I have some emergency today other than COVID, I can't get myself operated because hospital will not do a COVID test for me. Don't play with words, don't play with techniques, don't play with the rules, but use them as which is good for country or which is good for Delhi in specific. And I'm saying, if you open up mosques, this is going to be very worse. You're trying to open up schools. Another thing, you're trying to open a metro, which will bump
Mr. Singh, I am trying to understand. Mr. Singh, I am trying to understand that if you agree with the Aam Aadmi Party and if you believe that we could hit 2 lakh cases within the next 1 month and 5.5 lakh cases in just 6 weeks, then why is it that your party is insisting that we open up Delhi hospitals to outsiders as well? Are you not concerned? What happens to the people of Delhi then?
See, outsider mean what? A patient who has a heart problem, who has a pending heart operation, or any other emergency, for them, for COVID, they can. I'm saying, who will dare to come to Delhi? I mean, do you think anyone is mad to come to Delhi with 5 lakh patients, which will be COVID patient? Will anyone risk his life? No one's going to risk his life until there's a great emergency here. And it's only for emergency. I don't want to name a patient.
Correct.
I got a patient operated today for a cancer because, there was no option. And then she has to go all the way to Medanta to get a COVID test and operated here. Dr. Rana will vote this. So my request is, don't politicize it. Don't play with data, don't play with rules, and don't put blames on center. The center has given this rule, ICM has given this rule. Sir, they give you upper mark. You can do whatever you want to do within that. If they tell you open a restaurant, don't open if you feel it's not necessary. If they tell you to open a metro tomorrow, don't open a metro if you don't feel it's important. If they tell you to open a school, don't open a school if it's not important. So it is up to you to take a call. Save Delhi. We are there with you. I'm telling you on record. You whatever you want, please. Give a pass up my number to them. I take responsibility on behalf of Delhi BJP. We'll go to any mile, to any step to help them and to be with them in fight against Corona.
Tanvi, can I just come in?
Akshay Marathe, here is the BJP saying if you want the hospitals, issue a circular and take over the MCD hospitals. Yes.
Tanvi, I really welcome Sardar R.P. Singh's comment. He's a very respected BJP leader. So I have a very small request for Shri R.P. Singh ji. Safdarjung Hospital has a capacity of 3,000 beds. Right now, it is taking in only 283 corona patients. So if the BJP leader on the panel can also talk to his government. Similarly, AIMS is taking in only 300 corona patients when it has a capacity of 5,000 beds. So while MCD hospitals are also available, I would request him to talk to the central government and open up these big super speciality hospitals for the people of Delhi. Now, let me come to the other part of your question about where...
Can I make a small point here, Akshay? Can I give you a small point? Sir, those are reserved for treatment otherwise, sir. There are not only COVID, there are people otherwise. You can convert your hospital 100% to COVID.
Sir, allow me to finish, sir. I was not interrupting you. On the question of where these 80,000 beds are going to come from, the Delhi government has already explored all possibilities of, one, attaching several hotels to one single hospital, and this is already being piloted with Max Hospital and with Fortis Hospital. You can get your reporters to actually check this. We have started attaching various hotels. Apart from that, we have identified 5 stadiums: Indira Gandhi, Talkatora, Pragati Maidan, Tyagraj Stadium, and another one. I forget the fifth one. But there are 5 stadiums that we have identified where we are talking to several vendors who will be able to convert them into hospital beds for us. But like I said, this is something that we are planning for the future. Today, we don't have a problem of bed capacity because there are 4,000 beds lying vacant in our hospitals as of now. We are talking about a future possibility, and the government of Delhi, Mr. Arvind Kejriwal's government, is working towards this crisis, and we are confident we are going to be able to deal with it.
Can I make a small point?
Okay, let me just go across.
Very small debate.
Yes, small point. Okay, yes, Mr. Singh.
Hospital. Very small point. Akshay, those beds are for those patients who are to be treated otherwise. Who treat them? I mean, cancer patient, heart patient, kidney patient, liver patient. There are so many diseases otherwise. So they need to be treated. I'm saying, why don't you, what is available, why don't you take them up? I'm saying pick up complete block of MCD, pick up, request to railway, ask them to provide you the railway coaches. I mean, whatever can be, which were prepared for COVID only. So start working on it right now. I'm saying pick up all dharamshalas, pick up all hotels, whatever you want to do, go ahead and do it. But don't start pointing figures. And I'm saying,
no, okay, so okay, now we are repeating these points, and I want to take this a step further. Okay, yes, one big part has to be additional beds, has to be additional ventilators, has to be additional medical staff. If you're going to tell me that we have to prepare for an eventuality of 5.5 lakh cases in less than 2 months from now, then we will need additional medical staff, ventilators, support structure. It's not just about beds. It will be a lot more, and we will have to test more. Do we have to relook at our opening policy, Dr. Monga? Because, everybody is of the belief so far that we can't forever be in a lockdown. We have to start opening up. But if suddenly the Delhi is seeing this spike, should that be relooked at until we get our infrastructure in place?
That's right, Tanvi. Basically, the government is expected that because there is a committee, there is a panel which has given its recommendations or report. And the figures of 5.5 lakh, it's a government figure. Now the government figure or that committee should definitely devise ways and means to tell the government that these things need to be done to be able to cope up with the rush of patients in Delhi. And that it's a government that has to do. And you rightly said, I mean, central government hospitals or MCD hospitals or railway hospitals or NDMC hospitals, they can all be taken. I mean, they should have they should sit on the drawing board and plan things and then come to the public. I mean, trying to create a panic just for nothing is, I think, is a mindful mindset of the government. Number two part is it is not that very easy that, I mean, you are expecting on 31st July so many cases. So you will start on 15th of July. You have to plan now, getting ventilators, even getting oxygen pipelines or oxygen concentrators or PPE kits and everything that has to be planned well in advance. I think the government is still sitting on these figures and doing nothing proactively. I'll agree with Dr. D.S. Rana also that, I mean, we should have those figures. If we are having these figures, we should have the figures of number of ventilators we are going to buy. And the same government has been saying for the last many years that there is no dearth of money, we are pretty rich, we are surplus, and all these things have been happening. So I think for the God's sake, that the government come out with a formula that 80,000 beds by the end of July will be here and here and here. That, I think, should be the spirit. That is what the public expects from a government.
I agree with Dr. Monga
Okay,
when he says
all
that.
right. That's one aspect. Now, yeah.
Yeah, apart from beds, we have to look at oxygen concentrators, we have to look at ventilators, we have to look at oxygen cylinders. So our government actually is in the process of procuring all of these things. We have already procured a lot of these things. So in fact, the central government is in the process of procuring 75,000 oxygen cylinders, which it will give out to states which are in need, and we will work with the central government to procure all of these things that will be required to convert our beds into fully functional operational corona treatment beds. So I would assure you that the government is working with a plan, and we are confident of implementing it.
Okay, now I get that. So now here is my question. Since, on this panel, everybody believes that we need to work towards a scenario of this, then if we are saying, Dr. Monga, let's begin with you, that there is a possibility that the number of cases go staggeringly high at this exponential rate, then why are we so, hesitant to call this community transmission? Is this not community transmission? Won't that entail a larger policy change?
Definitely, there is. I believe that there is community transmission, and because most of the people who are coming to smaller hospitals also with cough, cold, and breathing difficulties, we are not able to trace the contacts. And even the health minister has admitted that at least 50% of cases we don't know from where that infection has come. And so many housewives, pregnant ladies are coming to hospitals and saying that I've not gone out for the last 3 months anywhere, and we are still getting that infection. And I believe that at least in Delhi and Mumbai, there is a lot of community transmission, and we should admit it. If the governments are not doing it, it is up to them. But as a public health expert, I'll say that these things are happening. And even containment zones, we start with the 80, 90. Now the containment zones have gone up to 200. It's not a small figure in a small, Akshay was talking about the numbers. I believe it's a small place. Delhi is a state, but Delhi is what? Around 1100 square kilometers, not more than that. And if you cannot compare it with UP or Maharashtra or other states also, so stick to Delhi. Delhi demography is different from other parts of the country. And as far as your question is concerned, definitely we are into community spread in a big way.
Yeah. Why doesn't the center admit this, Mr. R.P. Singh? If you are saying that and the Lieutenant Governor, by the way, as we were debating this, has come out and given a comment to the media, and he has said we need to prepare for 80,000 beds, obviously believing that there may be a possibility of these many cases. Why are we shying away from then admitting this is community transmission? Let's change our policy accordingly.
It's not me or you are expert on this. The experts will have to decide, and then we have to go by what expert says. If they say it's a community transmission, we accept it. If they say we are still away from community transmission, we have to accept that. It's not people sitting on your panel. Dr. Monga is a very highly regarded person. Dr. Rana is a very highly regarded doctor, and then they both are very learned doctors. But they need to be part of the panel which has to decide that. But coming to the issue, we still need to be prepared. I mean, whether it's a community transmission, I can debate on that. I can give you 10 follies where Delhi government has failed on how they could avoid community transmission. But I'm not going to that. But I'm looking forward. How do we prepare ourselves? How do we gear up ourselves? That's more important. And then Akshay, please don't open up Delhi for a while. For just month and a half, please avoid opening up. Nothing will happen. The hell won't fall. Please. Try to work it out, and then we are prepared to go to all levels to support you. We are prepared to go to any level to support you. Only request is gear up now. It's a time to gear up. Instead of just putting ads on newspaper, on coming on TV every day, that we are 4 times ahead of Corona, that won't work. We have to actually be 4 times ahead of Corona.
Can I come in?
Yes.
Tanvi, I want to explain once again why it is so critical that the central government accepts that there is community transmission. Right now, when I say that we need 80,000 beds, it also means we need paramedics, we need nurses, we need doctors, we need other support staff to be able to actually operationalize these beds.
Correct.
This staff is actually available in Delhi.
Your call has been put on hold. Please.
Instead of being used for actually treating patients and actually working on treating corona patients, this staff is busy in actually contact tracing because our current strategy does not admit that we are in community transmission. So there are thousands of people who actually can
Yeah.
be used for treatment, who are being diverted for something that is now becoming redundant. So therefore, we implore the central government to think about this
Yeah.
and to consult experts, and not just for Delhi, across the country, wherever they can find such instances, whether it's Mumbai, Chennai, Ahmedabad, and Gujarat. All of these cities actually do have a crisis at hand. We need to move to a new strategy, and unfortunately, only the central government is going to be able to do that. So, Mr. RP Singh ji, when you say that what does it matter
Yeah.
whether it's community transmission or not, it is not the case. Please request your central government. It is also our government. We are also talking to them. But since you said you have been very forthright on this debate, please talk to your leadership, party leadership, government leadership, and talk about making this clear and declaring that we have community transmission.
Akshay, don't take shield under
Okay, very quickly, I also want to bring in Dr. Rana.
Very small point. Very small point. Akshay, don't take shield under this technical term of being community. You are saying that we will be 5 lakh cases, so we need 80,000 beds. So you can be prepared for that. Get doctors, get nurses, get paramedics, get beds. So don't get into technical. That's the bad part on your party. See, you say Akshay Marathe given a guideline. Oh, you tend to
No, Mr. RP Singh, you know, I agree with you to a great extent that this is just a technical term. It's visible. Community transmission is happening in many parts of our cities. But if that leads to a change in policy, if that leads to implementation and inclusion of additional resources and diversion of resources, then perhaps that is needed, especially for cities like Delhi. Even if it is happening in Mumbai or parts of Mumbai, even there. Very quickly, I just want Dr. Rana to come in on this. Dr. Rana, if we are saying that the cases are going to increase exponentially, what about the medical staff? What do we do for that? The hospitals can't have the same staff dealing with such large number of cases 24/7 for 5 straight months.
Try to understand one thing. That once you got to treat serious patient of COVID-19, you require 2.5 times more staff. Especially nurses and others. So it is a scam. Today I was planning to run about 200 beds, now say 200 beds in our hospital, and we are finding difficult to get nurses. And right now, from where we will get nurses? That is what we have to find out the solution. So there will be very huge shortage of staff. As Akshay was telling, be it doctor, be it paramedics. So that is what we have to prepare. I just want to make two appeals. One appeal that don't utilize right now, today, the full capacity of tertiary care hospital meant for providing tertiary care for all the people from all over the country, not only Delhi. And number two, allow the hospitals to run labs and have faith in doctors, have faith in the administrator. We are all here to help people. And if there is any hospital erring or any doctors erring, the government has got full right to punish them, whatever they want to do. But I think we don't do it on printed media or electronic media. And let us have dialogue, With these things, I will just like to, I think
All right.
Yeah.
Yes, absolutely, Dr. Rana, you're right. And this is what I wanted to also add, that it's not just about saying we need 80,000 more beds. We will need 2.5 times more support staff and medical staff. Remember, viewers, our doctors, nurses, the support staff, the ambulance drivers, they've all already been working round the clock for the past 2 months, 2.5 months now. They're already exhausted. They have a long battle ahead. For many, many more weeks and months this will go on. And the only way we can make their life easier is by figuring out alternate resources, by ensuring that proper containment measures are taken, by implementing those containment measures. If Delhi and Mumbai are struggling today, Bengaluru isn't. Maybe there is a lesson to be learned there. If Delhi is today saying and indeed believes that in the next 1.5 months we will hit 5.5 lakh cases, that this needs to be priority number one, not just for Mr. Kejriwal, but also for the central government. This is the national capital we are talking about. 2 crore people living there, that's what we are talking about. They can't forever be in a lockdown. We need to find a better way of resolving this situation and the massive crisis, if that is what it is that we are staring at. If this is just fear-mongering, then we will have to wait for these politics to die out, and one can only hope that we don't see so many cases. That's just our hope. Thank you so much for joining us on this conversation.